Good morning, ladies and gentlemen. Though it could be good evening and good afternoon in few other countries. And this is my first experience to join on a virtual meeting. And this session particularly is about consumer groups, which is working in the different Asian countries. The one in India, which I am also vice president for the same, is the Spinal Foundation. It was launched in May 2014, so it's hardly 6.5 years. But I'm very proud that what we have been able to achieve in these last 6+ years. The Spinal Foundation, collaborative platform. 18 months of very hard work have get together 20+ organizations across India under the same umbrella. It's a registered organization under the relevant law of India. Launched on the birthday of Dr. Mary Varghese, visionary doctor on wheelchair and the pioneer of rehabilitation in India. She was a physiatrist in the Christian Medical College, Vellore, where she became a spinal cord injury later, and she set up the first rehab center in India. President of the foundation is Padma Bhushan Major HPS Ahluwalia. Some of you friends would know that he was part of the first Indian summit which hosted flag over the Mount Everest in 1965. Vision of the Spinal Foundation is very, very clear. It's one line: enhance quality of life for persons with spinal cord injury. The sole aim is to achieve this. And you see, any organization, any institution, or such forums, they need proper networking. Then only they can really succeed to achieve their vision. 25,000 plus persons with spinal cord injury are part of the foundation, and we are still growing in number. Leadership and core team in almost every state in India. As part of the foundation, we have team in almost 28 states of India. And state-level organizations are there in 10 states. Extensive use of social media and WhatsApp to augment networking. We have almost 7-8 WhatsApp groups where some of the very professional, I would say, peer mentors and other professionals, doctors, physiotherapists, nurses, are part of the WhatsApp group along with the consumers, so that nothing what goes from the WhatsApp group is unscientific or not very justified. Expanding numbers of networking meetings every year across India. We hold them, and the most, I would say, the best and successful program is peer mentoring programs. More than 250 peer mentors across India are being trained. We held training classes on tele rehab in 2014 and 15, and 50 of them are paid peer mentors all over the country. You'll be surprised to know that 3 peer mentors are constantly on travel from wherever they are needed for active rehab training and other purposes. The best part is that peer mentors are specialized for women, quadriplegics, and in areas such as skin, bladder management, bowel management. What I mean to say is each peer mentor is trained specifically in one area so that he masters that, though they are jack of other trades, other issues as well, but some of them are very well trained in one particular area. All healthcare guidance is being provided. All key areas, depending on the level of injury, rehabilitation outcome, skin care, pressure ulcer, management, bowel management, sexuality, clinical research, every aspect of spinal cord injury care, treatment, management, rehabilitation is being taken care of. And best part is it is delivered in vernacular languages depending on the state and people of those places. And you'll be happy to know that 3,000 plus expert guidance for ongoing issues faced by persons with spinal cord injury are there from all over the country. India's Spinal Cord Injury Day. The idea and plan in 2014 was being launched and was being launched in 2015. Slowly, this idea and concept note went into as through the Asia Spinal Cord Network meeting in Nepal, and then International Spinal Cord Society, and now it has taken shape of World Spinal Cord Injury Day. But the basic idea came from the Spinal Foundation. We are proud to say that. And every year the anchor event is held in Delhi, the national capital. And World Spinal Injury Day, you know very well that each country participates according to their expertise. And expanding universal events on September, when we are trying to go into very small places in small villages, remote areas, to take this message of World Spinal Injury Day and related issues even to the smallest villages. You can see we had this Prevent Spinal Cord Injury car rally from almost he covered the complete India and he himself is spinal cord injury. We have Kotak Wheelchair Marathon every year in Chennai, and we have shows on the Indian spine, that India Gate in capital. All sort of activities are being carried out. And you see, we also share rehab expertise with upcoming new rehab centers, especially Chandigarh Rehab, which has come up. We have tried that each and every aspect of rehabilitation is being taken care of. And we are expanding the network of 300 plus quality rehabilitation professionals, be it physiotherapists, occupational therapists, nurses, or physical medicine and rehab people. We are trying to enhance the quality of rehabilitation with peer trainers at Vellore, New Delhi, Chandigarh, Raxaul, Kolkata, and other parts of the country. You see, for any such organization, advocacy remains one of the most important points on the agenda, because we need to sensitize Government of India on spinal cord injury, and that's what we are doing. Expertise sharing policy on accessibility, good Smartian law for responses at accident sites, safe handling at airports, and rehab training are some of the areas that we have tried to cover in our advocacy. Guidance for a few state-level initiatives. And CAT disability services and training. With our efforts, 15 persons with spinal cord injury are studying at premier management institutes since 2017. Mobility devices is a very needed area to be addressed, because proper wheelchairs and other aids are not available. The Spinal Foundation has partnered with Indian Institute of Technology Madras and a cell, or rather a small setup of new motion has been set up there, an initiative across India to develop standing wheelchair, world-class manual wheelchairs at 25% of what a comparable imported product could cost are being designed, tested, and we have started distributing and selling them to the needed people. This has been a COVID pandemic year of, and that is the reason that I am speaking on the Zoom training for this presentation, for virtual presentation. And for COVID, the SPAN Foundation initiative and first guidance on 4th March, when it was just beginning, 2020, and India just had 29 cases.
0 deaths.
Focused guidance centered around importance of social distancing, stay at home and physical distancing. That's what we tried to spread around through our social WhatsApp groups and other social media and other meetings and otherwise. Detailed guidelines, notes in mid-March, May and June, and translation of WHO materials
13
languages to expand and reach across India. COVID-19 pandemic and spinal cord injury, visual guide launched in mid-May, special training for peer mentors across India, vernacular languages calls since end March, and guidance for persons with spinal cord injury affected by COVID-19 for whose family members had COVID-19 illness. All these areas were being looked into. Touch Rehab is a new initiative which was being launched on this last month, on August 15, the Independence Day of India. Independent living training using video calls. Because in this time of pandemic, it's very difficult for people to come to hospitals and take risks. So we are carrying out this initiative for the users, by the users, with support of best-in-class health experts. Takes independent living training into the homes of every person with spinal cord injury. On 15th August, 20 persons with spinal cord injury were in training and 24 waiting to be trained.
Imtiaz, who had been confined to a bed in one room for last 15 years without even a wheelchair, stepped out of home for the first time earlier this month.
Awareness through wheelchair marathon, running for ability, awareness ambassadors, Kashmir Kanyakumari drive, Dreams invited drive outreach by tricycle, and Dr. Mary Varghese Award. All these are initiatives so that people who are doing good work in the field of awareness are being awarded and appreciated, and it's a wonderful management what we have come with for the Smile Foundation. Indian Council Chairperson. There is a governing board, but all these two, India Council and governing board, have members with spinal cord injuries. But the advisory board is of all people, be it from media, be it from banks, finance, be it from other experts, any medical professional who are part of the advisory committee, so that we can take guidance from them to take the cause of SCI further. Mission is that by 2030, the Spinal Foundation should be something like SIA,
Spinal Injury Association UK,
Rick Hansen Foundation, and others rather. That is our future. Thank you so much.